Hello, 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 everyone. Happy Monday, and welcome to Monday Nurse's Life. This is Sharon Herbert, the Power RN, and I'm coming to you live from Power in Nursing Innovations. So it's so good to see you all today, even though the weather, most places that I have been or talked to folks in the last couple days, it's been kind of yucky. But, if we're still going and flowing, we are okay to be sharing and caring. So, today, I have a lot of thoughts about the pandemic, and I wonder what you all think about the pandemic. Is the pandemic over? Because I think that what I've heard is from folks who really aren't frontliners, and they may be politicians or physicians or, someone who's in a social setting or a director of some department of something. I don't know about the CDC, but those places. So I wonder what you all are thinking about the pandemic, and what are your thoughts? Because maybe my ears weren't working that day, but I thought that I heard the president saying that the pandemic was over, and I think that was a week or 10 days or so ago, but I had to kind of do a double take. Now, is the pandemic over? Or maybe they were referring to another pandemic. What about this COVID-19 pandemic? And I believe from talking to epidemiologists and some other folks who are really closer to the understanding of the pandemic, they're saying no. Now, not completely over. So they think that it's risky to declare the pandemic over when there's still another wave coming, and who knows what other variant is coming, some Omicron, something another. And the only thing that I think, can perceive is that it's not as bad as it was when it first started. And so I wonder if that's the perspective that we can take and discuss. Because the pandemic is still spreading, and as we know, a pandemic is defined as the spread of disease worldwide. And so it is well that it isn't officially declared over until the World Health Organization says so. That's the point. And I know we can think it sometimes, well, it's always something and always somebody saying something, and who knows if they know what it is, and then they pass it along and someone else gets it, like that, that old telephone game. You pass it along, and then someone else passes it along, and it's not quite what you shared in the beginning. So how do we know when it's over? Right now, we might be able to assess that maybe the worst of it is over. And if that is true, how do you decide whether it is true or not that the worst is over? And it pretty much depends on who you are and where you are. Here in the United States, the answer might be yes for most people, because the way that we look at it is in our own backyard. What's going on in our area? Even though somewhere, there is an outbreak in some other place that you've never heard of and certainly never been to. So you think, well, it's not as bad as it was. And that might be the reason that people think that it's over. It's just going in the right direction. We are looking for it to be over. But what will determine when we know the yes or the no? Who, do you remember? That was a few moments ago. Who determines when the pandemic is over? WHO. Oh, that was the WHO. That was the joke. Aha, gotcha. The World Health Organization. So, right now, we can't say so. But things may have gotten better, even looking at the numbers in your state or in the United States. It fluctuates probably from state to state by the numbers of folks who have been hospitalized and died. And even though people are or have been dying, they are not always hospitalized or haven't been. And so the numbers will look a little different as you go from state to state and case to case. And in addition, the ability and capacity for vaccines and immunizations has changed the numbers a lot. So, how have vaccines affected the numbers and the outbreaks in the places where you live or work? So there's a reason. That's another reason that things look better. And, as we will say, we have more supplies, whether in the health organizational spaces and or in the public, for helping people deal with the COVID pandemic and the outbreaks. So if you have now access in the health organization in your hospital for appropriate supplies, whether they are gowns, gloves, sanitizer, enough space, etc., things can be handled a lot better. Staffing is also and always has been a challenge for the healthcare system. And I say, yes, the system. So the system is a big wheel, and it has lots of spaces and components, and that is a factor in the whole. So each of those components or spaces has impact on the entire health system wheel. So just remember that. So, as we say, we are gathering all of this information and data, but we really can't make a full assessment unless we have all of the data, and the data is correct, and then we know how to use or implement the data in our study or in our research project. You have to know how to use all of it once it's collected, or it really won't be of any use to you or to your community. So, as we collect data and implement the use of the data into our system or the health system, what does it mean for us today and tomorrow and each and every day? We're looking at the outcome or the output of the study, research, the information, the data collection, and looking at how or if it is making things better by even just simply the number of cases without having everything all exactly in a row, working your way steadily towards that. We don't have all of the numbers, and we won't have all of the numbers until when? Until the pandemic is over. And it will still be some time until then. So, what do you think? In the interim, we're still working the healthcare component of the pandemic is working to make things better for the community. Whether it is the number of cases or the spread of cases or the implementation of vaccine resources, there are so many ways that we can help each other be better and deal with the pandemic until it is over, or whenever it is over. So we're dealing with it today here. I am in Maryland, in the U.S. of A. And we are doing fairly well. But you can never tell by just walking in the public or looking around what people are thinking about what COVID means to them. Do you wear a mask or do you not? Do you wear gloves or not? Do you have hand sanitizers in the spaces in the community that you may frequent, like the grocery store or the library? Do you have appropriate containment for the sanitizer? And is the sanitizer available each and every time you enter that space? So if there's a container, but it's empty, what is the use? And if it's a container and you have to touch it with your hand to get the sanitizer, what's the use? So, how do we help each other deal with where we are in the cycle of this pandemic? Some places as far across the ocean or farther than we can see, maybe it, like sub-Saharan Africa, have more deaths, and there are, but for the grace of God, our rates, because we have been vaccinated and or the number of vaccinations far exceeds those in sub-Saharan Africa. We could also think and talk about social distancing and other things that are different from place to place and space to space. And you may not get exact data from your brief observation, but hopefully it will make you think. For me, I have hand sanitizer. I have a tube hanging on the side of my purse. I take my purse with me everywhere, every grocery store, and it may or may not be perfect, but I will say this, it is mine. No one else touches my sanitizer, and I keep it with me at all times. When I leave the grocery store and I return to my vehicle, I put on my sanitizer before I even open the door. I have it with me on my purse, and once I enter inside my vehicle, I have more sanitizer, and I just kind of tap down my steering wheel. Those are two places that I'm going to touch before I even really think. Like, open the door, okay. Get in the car, okay. I don't need to touch anything to sit down, but once I sit down, I'm going to touch the steering wheel. That's probably the first thing I'm going to touch. So being thoughtful is helpful, but still, who's wearing a mask and who isn't, and in what spaces and what places. And if the CDC has said, well, we don't have to wear masks all the time in all the places, do things like honoring folks' rights to not be suffocated by their masks. I know, that's a little far out. But in any case, those things we just really have to think about. So, keeping those things in mind, it's a lot to juggle. And sometimes it's jiggling. It's not even juggling. And some of the things are, up and down and on and off. And that is also the reason that we all must await a ruling and decision from the World Health Organization. Because I do things this way, you do things that way. So we don't all have the exceedingly popular determination at our hands at all times. Might change from day to day. So listen for what the WHO says and pay attention. Pay attention and be as safe as you possibly can and govern yourself in that manner. Now, whenever it comes to a place where the numbers are slowing down and slowing down and slowing down in your community and throughout the world, including sub-Saharan Africa, then you might be looking to almost say, I think it's over now. That's going to be a long while, probably. But keep your ears pierced so you'll know what's going on. And even then, you probably won't have one single moment or day or time when you'll hear the announcement, pandemic has been declared over by the WHO. You probably won't hear that. But you may have to wait to hear in hindsight that it is over. Now, I don't believe that there's a clear determination on that day and or time, but stay alert and stay aware. And in the meantime, this is a tip and a thought and homework for you. What is going on in your own organizations? Mask mandates, visitation policies. How are those things being treated? Are your cafeterias open to everyone once again? What about the lines? Is there social distancing? Lots of things are available for discussion and debate. But I don't know if there's any real right answer. Each setting or place that you enter is going to be different from the last place. Are you going to the movies now? Are you going to the park? Are you going bowling? Are you going swimming? Are you doing things that you did before because you just can't stand to stay in the house another day? Summer? Time for open air activities in the past, and you just can't take it anymore. Will you return to schools on face-to-face? Churches on face-to-face? What are you doing with how the pandemic affects you? Are you still having to work additional hours at your hospital, particularly in the ICU or the ER? Or has that kind of dwindled down a little bit? Is staffing better? Is staffing the same? You have new grads? Are they being inducted into your organization the same way it has been before? Before the pandemic? Before those folks even started in nursing school? It was 4 years ago. There was no pandemic. People were going to school, going to classes, going to clinical, and touching patients. How has the world changed for you? Things to think about. And as we are looking forward to the future, we would love to be available to answer some of these questions. So we help each other forward as we go on. And we think, because we're always thinking, of solving these problems for tomorrow. And even if they're working for today, if you're a quickie and you're solving the problems for today so that life can be better for each of us tomorrow. Remember, the future is yours. And the future of nursing has been in a debate since really the pandemic started, because some things changed a lot. Staffing has always been a component of our nursing promotion, but it changed with the influx of critically ill patients and more critically ill patients, and not enough supplies, staff, etc., etc. So some things changed a lot, and some of you may be thinking of leaving nursing. But please know that you are so sorely needed. Even if you didn't feel every day that your supervisor or your CEO thought you were valuable, we know that our passion for nursing and service and care for others and for ourselves drives what we do. And like I say, I can't sing or dance, so I gotta do something. And I love what I do, and helping you all stay committed to your passion and your purpose is my goal. So let's talk about how we can move nursing forward as we await the end of the pandemic. We can't sit on our hands and just wait for the WHO breaking news. We've got to continue to move forward. So let's think about where we are today. Today is October 3rd, 2022. And we are in our third year, and a little more than half of that third year of the pandemic. So we don't know when it'll be over. We know today may be better than yesterday. But nursing must survive. Nursing must survive this pandemic. And we need your care and service to get that health care wheel balanced so that we can all move forward and have better days, less of the pandemic, and maybe more new innovations for nursing. Because here at Power in Nursing Innovations, we're all about dreaming and thinking, and those solutions will change the world. So follow me on Power in Nursing Innovations. I'm on Facebook here, and I am also on Instagram, The Power RN. LinkedIn, Power in Nursing Innovations, and Twitter at Power Nursing. But you'll also see me speaking and promoting the profession of nursing. You'll see me on stages, writing books. You don't want me to sing, but I can write some lyrics, and we will grow together. So, having said that, I am so glad to be with you all today. And thank you so much for sharing and caring with the Power RN at Power in Nursing. This has been Monday, Nurse's Life, and we'll see you again next Monday. Be well, my friends, and live your best nurse life. Passion, purpose, and power are available to you. So we will see you next time. Dream on, dream on, dream on.